How's everyone doing? Great. I don't really know where to stand. This seems like a good spot, kind of in the middle. So my name's Dr. Peter. I'm the owner of Hybrid Spine and Sports. We're a rehab chiropractic clinic. We really specialize in patients who want to get to the root cause of their pain and fix it for good. We're not the quick, come in, crack your back, see you next week kind of thing. We want to really spend the time with someone one-on-one to figure out why you're having pain and build a proper rehab program to fix it. So these types of seminars are a lot of fun for me because we get to come out and meet a ton of people and give you guys a lot of things that most traditional healthcare providers tend to miss. When it comes to lower back pain, there is a few things that most healthcare providers miss. They always focus on lower back, which becomes an issue, right? So as we go through this, please if you have questions, just raise your hand. I love questions. These are way more fun when it's more interactive and I'm not just talking at you guys for a whole hour. We'll talk first about lower back pain, why it typically happens, and then I'm gonna give you guys some exercises that most people don't realize they're missing, and hopefully give you guys as much free value during this hour as I can. So right off the bat, lower back pain, who is currently in lower back pain? Cool. Who has had it in the past? Right, just about everybody, and myself included, right? That's kind of what got me doing what I do now. When I was younger, mid-20s, I had debilitating lower back pain. I was doing jiu-jitsu 5 times a week. I was lifting, I was doing different martial arts, yoga, and my lower back would flare up so bad I couldn't stand for more than 5 minutes. If I walked, I'd have to sit down constantly, and I was in great shape, right? I was able to do all these things, and if you looked at me, you're like, wow, he's in great shape, but really I was really a wreck. I went to a medical doctor. They just prescribed me drugs. So I was like, cool, now I'm high and can't drive. That's not fun. I went to the chiropractor. I get adjusted. Was way worse after. And so I ended up different things. I got a yoga for back pain DVD, and I would do that twice a day. I mean, I could still remember almost the whole sequence from seated, stretches, moving this, and after would be way worse. And I was, you kind of think all right, no pain, no gain, this is just the process. And it wasn't until I found a provider who actually taught me I was breathing backwards and my left hip did not move, right? So because I was breathing backwards, that's what we're gonna get into, my lower back was having to compensate for my deep core not working. And because one hip did not move from years of boxing and Muay Thai, every time if I would walk, it's almost like my lower back would extend and walk me like this. So the lower back, in my case, and in 95% of our patients' cases, is never the real problem. It's the compensation for something somewhere else, which is the problem. That's what we call the root cause, right? Could be coming from a foot, a hip, a deep core, a thoracic spine, a rib cage. We just have to figure out what somebody's root cause is and then build it in. Build in the rehab program to fix it. So what we're gonna do today is we're gonna go over some of the most common things that we find in the clinic that most people tend to miss. Great. What questions or comments or things do you have on all of that? Nothing. Okay. So let's get into it. So when we think of core, what are some things that just pop into your head and you think core? Abs. Okay. What else? Stabilizers. Great. Breathing. Yeah. Kind of preface this a little bit. Good. Anything else? Balance. Great. Yeah. Posture. Good. Yeah. So when people think core, oh, thank you. Yeah.
I was having a hard time. I was hearing that.
Gotcha. I've got the remote. Okay. When people think core, they tend to think of the muscles that we train. The abs, the planks, the sit-ups, the crunches. And we really have two cores. We have that core that's made for movement. I always joke that if somebody has abs, doesn't mean they have a strong core, it just means they're hungry. So we have those muscles, which are fine, but they're made for movement. And then we have our deep stability core, which is made for breathing and pressure. We have to understand a proper breathing pattern and how we create pressure through this entire core. That way, as we're breathing and we're always pressurized, our lower back is always going to be supported. And believe it or not, like a lot of people breathe backwards and they use their core the wrong way. They use these muscles made for movement, the abs, the crunches, the things that we would train in the gym, and they try to use those for stability. And they're not made for that. So what happens in that case is that lower back has to compensate for that deep pressure system not working. Where we compensate, we get pain. And this is a big issue with a lot of modern healthcare is they hear lower back pain and they do all the things for lower back. We're going to stretch the lower back. We're going to dry needle it. We're going to adjust it. We're going to massage it. And while that feels good and it is important, it doesn't really ask the question of why. That's like, this drives me nuts about healthcare providers, or just in general. It's, okay, we're having low back pain. Well, why? Well, I'm getting older is not an excuse, right? There's inflammation. Well, why is there inflammation, right? There's a reason why these things happen. And if you don't understand the why, then you can't ever fix the how. So when we start thinking about deep core and getting deep core online with proper breathing patterns and loading patterns, now all of a sudden, this whole cylinder works really well. And then the lower back can finally release because it's not having to do all the work all the time. This is so common. We hear patients, it's first thing in the morning, they like bend down to tie their shoes, they come up and they throw their back out. Or they reach over to like pick up a water bottle and they throw their back out. And it's really the straw that broke the camel's back. The lower back has been doing everything because deep core has not. And then eventually it just goes into spasm, and then you're on the ground for like 2 days. Okay, questions on that? You guys are a quiet group. That's okay. Well,
No, everything you're saying makes sense.
okay, that's good. That's good. Okay, so what we're going to do is we're going to start talking about core. Haley's already getting ahead here. So we're going to start talking about deep core. This is the number one thing. 98% of my lower back pain patients we have to retrain breathing and how they actually activate their deep core. Like almost every single low back pain case is that. Unless somebody like got hit with the hammer in their lower back, it's like, well, breathing's not going to fix that, right? So my least favorite cues ever is belly button to spine and zip up your core. It teaches you to brace your core backwards, and it makes your core weak because we're using those movement muscles, not the deep stability muscles. And it's not, I always say, preface that when I go to a gym and say, because I'm sure you guys have heard the same thing. I used to use those cues myself. Like I was a yoga instructor, taught kickboxing for years, and belly button to spine, brace, everything sucking in is the absolute worst way to brace your core. And whenever we don't use this the right way, lower back is like, oh shit, like, gotta do work. So, what we're gonna do is we have 2, 4, 6, 8. Oh, perfect, we have an odd number. So I'm gonna use, actually, Jess, perfect. So you're gonna do a little test. So we're gonna partner up, and I'll show you first what we're gonna do. And then we'll get into some breathing drills to activate. If you've had a history of any sort of abdominal surgery, C-section, gallbladder removal, appendix, tummy tuck, diastasis recti, any sort of abdominal surgery where they have gone through your abdominal wall, know that these next drills are going to be very difficult. It's such a travesty that, you know, when you guys, like y'all females, if somebody has a baby, you know, as soon as they can get you out of the hospital, they're like, cool, figure it out. And you don't typically get the retraining how to use your core again, especially with C-section, right? They cut through the abdominal wall, and then now you have to go look after a baby and take care of another human, but then they don't ever teach you, hey, we need to actually learn how to use these deep muscles again. And so that will get offline, sometimes decades, right? We've seen patients who have been in low back pain for 2-3 decades, and they've had, you know, 20 or 30-year-olds at home, and since then they have no idea how to use their core. So this one drill in itself, like everybody should get after baby, after any sort of abdominal surgery or any sort of lower back pain case. Cool. Questions on that?
What about like a hernia repair?
Yep, hernia repair for sure. They cut through the abdominal wall, or any sort of like abdominal surgery, it takes this whole system and turns it off. Because when you're healing, you don't want to be using the muscle, right? Like if I tear my bicep, there's going to be a period after surgery that I'm not going to use my bicep. The difference is then after that bicep surgery, you go to physical therapy, and they're like, oh, let's get your bicep working again. It's the same thing. You have a hernia surgery. It turns all these muscles off, but then there's no physical therapy after. And so then you have to compensate. And the longer you compensate, the more years it goes on. This is where lower back starts getting tight. We start getting really rigid up here because we're not able to offload into here. So yeah, that's an important piece of the puzzle. So, okay. Yes, cool. You're gonna come sit here. So we're gonna do a test, retest. So just have a seat, cross-legged, however you want. You're gonna grab a partner, and I'm just gonna gently place my hands on her shoulders and ask her just to breathe like normal. Oh, there's a mirror there, she can see me. So I should not feel her shoulders come up at all. Okay? So I'm just gonna go here, and I'm just gonna make note of it. If I can feel her shoulders elevating, she's doing it wrong. And then we're gonna switch. And then I'm gonna sit down. She's gonna put her hands here, and she should not feel any muscle activation here. Cool. Questions? Grab a friend. 2, 4, perfect. Yeah. Breathe nice and normal, don't overthink it. Just hands on shoulders. And if you feel their shoulders lifting, I want you to tell them. Good, just like 3 breaths. No, there's a few. Maybe 3-ish breaths, and then switch. If you had your hands on their shoulders and you're not sure, totally fine. That's an important piece. So that was it too, yeah. So the upper traps, those muscles that everyone has tightness in, should be nice and soft, and they should not be lifting. Okay, that's okay. So this is a tough test to feel if you're not used to hands-on here. So the next thing we're going to do is she's going to do the same thing. Just sit comfortably, however. I'm going to put hands here onto her ribs. Just don't make any like, oh! Didn't work. She was ready for it. Yeah. So just at the bottom of her ribs, a couple more breaths. Okay. So I should feel her ribs push out and come back in as she breathes in and out. I can put a bit of pressure here. If there is no expansion, which she does not expand out here, she's expanding forward. right? So just right on the sides, hands are right here, and then just a couple breaths. You should feel these expand and contract.
This is just like normal breathing, not like deep breath.
Yeah, just normal breath. Okay, just a couple breaths. Again, if you feel expansion or no expansion, tell them.
What did you feel? No expansion. A little bit? Yeah.
A little bit. Cool. Yeah, here. Yeah, so there's nothing. Yeah. Okay. Feel how tight?
No, everything you said, I'm like, that's me. I'm here.
Yeah. So this, like, this over tightness through upper traps, this is for sure a breathing thing. Yeah. Okay. So, like we were just talking about, if you are someone who constantly has this over trap, like tightness, where you're just like all day can't get comfortable here, this is important for the drill we're going to be doing, right? Think about it. If one breath in should be down here, this should all expand together and drop together. If we are not breathing down here, we'll start to breathe up into this, where I'm all day, right? I'm over-exaggerating it, but a couple thousand breaths like this is going to overuse these muscles all the time. This turns into chronic tightness through here, headache, shoulder pain, neck pain. Symptoms show up for the same. These are my people who go get a massage, to go get adjusted. They feel great for like a day, and the next day, like, fuck, it's right back. And it's because they just released all these muscles, and then you left and did a couple thousand breaths like this. Like, of course they're going to get tight again. Massage is great, but it's not going to fix the movement pattern.
Does it have to do with how if you breathe through your nose or your mouth?
So it's not necessarily in. So I was actually reading or listening to a podcast with James Nestor. He's a big expert on breathing. It should be in through the nose, out through the nose. The old in through the nose, out through the mouth. He's like, it should change in through the nose, out through the nose. But whether I'm breathing here or here, the pattern should be here. So, other questions on that? So this breathing drill is very powerful. I know where it's a lower back pain workshop, but we have a lot of release that comes from here. It can be jaw, neck pain, sometimes even like inner ear stuff, like ears that don't drain. All these muscles just get so tight because it's trying to lift the rib cage all day. So we're going to start working on first. We're going to do breathing first, and then we're going to do proper bracing, and then you're going to get back with your partner, and I'm going to show you the difference. So, thinking of core and bracing, we have our diaphragm that is right here. It's right at the ribs. It bows up like this. We have pelvic floor on the bottom. These two things create the top and bottom of my floor, of my core. And then there's a deep muscles that surround here that create the outer walls. Think of this like a cylinder, almost like a Coke can. It's the best kind of visualization we can do. As I breathe in, diaphragm drops, pelvic floor drops at the same time, and core expands in 4 directions. As I breathe out, core compresses in 4 directions, diaphragm and pelvic floor lift. This is incredibly important for pelvic floor health. I don't look like a traditional pelvic floor therapist, but I do a lot of work with patients in pelvic floor, because if you don't understand how to create this cylinder and pressurize it, when you go to run, jump, double unders, and CrossFit's really common, you get leakage. So I digress. So what we're going to do, come around. I want you just to show a little bit closer. I'm going to demo what we're going to do. So, perfect. So you're going to be laying on your back. Your hands are going to be, you can kind of see right where my ribs are, and they're going to be laying right over top of that. If I can hook onto my ribs like this, that means we're not using our core, our deep core, right? So I can still breathe here, but see how I can hook onto the ribs? That's all the movement muscles working, not the deeper stability. So this drill, we're going to start to understand how to create pressure here and then regulate it. So hands are going to be here. I'm going to breathe in, and I'm going to cough. And whenever I cough, you're going to see my ribs are going to drop down, and my core is going to expand slightly. So I'm going to breathe in, and so now I'm keeping that pressure I just made through my whole body, through my core. And I can't hook onto my ribs anymore. They've disappeared. And now all I'm going to do is I'm going to breathe in, expand, and exhale, compress. Everything expands. I can feel expansion into the floor. And as I exhale, this all compresses. If I lose it, we're hooking back onto ribs. So now I've lost that deep core. So I'm just going to go back to it. Inhale and do that small cough. That just pressurizes my core. And then I can pass the poke test. This is pressurized. I'm not holding a sit-up. Breathing in. Everything expands. Not just down here, but up to here. Everything works together. And compresses. I want this, so try and find like a supple activation with this. Don't like overdo it. Find a supple activation. This mechanism should be happening at about 10 to 20% all day. Questions on that? So one more.
So when you're standing up and you're working or you're doing something, you should be thinking about breathing that way.
Yes. Initially, in the next couple days, I'm going to be in y'all's head a lot because initially it takes a lot of focus. So this is why we're practicing it laying on my back, just like here. Eventually, it just turns into the new normal, and the pattern will change, and all of a sudden you'll be here. It takes a while, but it's such a powerful drill. You'll find that if back is hurting picking something up, just pressurizing this the right way will immediately offload the spine. So one more time, I'm going to just turn. If I can hook onto ribs, not good. We're going to inhale and cough. Should feel ribs drop down, core expands in 4 directions. And then we just maintain this pressure. Inhale, exhale. Learning to do this will melt away this upper trap tension like nothing else, because now these finally get a break from trying to lift the rib cage up all day. So you're going to try and hold that for about 10 breaths. And if you have questions, please raise your hand. I'm going to try and come around to everyone and help. So you might be here for a sec. Cool? All right. On yonder. We'll start here. Cool. So
Breathe in.
we're going to breathe in. So we breathe in, we do that cough. There you go. Feel how ribs dropped, and keep the pressure with your cough, and then try and maintain that pressure as you breathe in and expand. Exhale down. So see how we lost a little bit? Mm-hmm. Take your hand and push into me right here. Okay. So as I breathe in and cough, and then
Real hard. Yeah.
expand, contract. If I lose it,
It's going back.
this is a mental game. Don't get frustrated with it, especially if you have a history of abdominal surgery. So, good. Keep that pressure. Yeah, there you go. Try and maintain that as you breathe in and expand. Yeah, good. Keep that going. How's this feeling? Good. Keep this. push my hands out as you breathe in. There you go. There, that's it. Keep going. Okay. I saw you from across. You look pretty good here. Let's see. So pressurize here. Push my hands out. Yeah. Feel that? Good. It might feel like you have a more shallow breath here. It's just learning a new pattern, and your body's fighting you a little bit. Yes, this will be a good one for you. So go to cough. Good. Pressurize. Push this out into my hand. Yeah. Keep it pressure. Nice slow breaths. Good. This is going to take more than me running around and poking you in the belly. Yeah, that's good. Feel how that's pressure? Mm-hmm. Great. Keep that going. There we go. Yeah. So you're using muscles. You're using the movement muscles, not the deep core. Good. Now breathe in and push out. Better. So push into me right here. Yeah. So not using core. See, we're moving and it's pressurized the whole way around. Cool? Good. Breathe in and push out here. Yeah, there you go. Feel that movement?
But it's like I'm working.
Mm-hmm. Yeah.
4 sections.
Mm-hmm. Yeah. This is very important. Yeah, I've had patients before who are like, can do bar muscle ups and toes to bar, and they've got abs, and we do this drill, and they'll text me the next day and be like, holy shit, like, what did we do to our core? I'm so sore. And it's because they're not used to using these deep layer muscles, so it's super common. Push out. Yeah, there you go. How's that feel? That's pretty good. Make my way around. Cool. Expand. Good. Compress. Yeah, so that's really good. For you, try and get expansion back here on the inhale.
Or
Neutral spine. As you breathe in, feel expansion into my hand. There you go. Okay. Oh, yeah, this is...
No, I've had 2 seasons.
Okay.
A long freaking time ago.
So ribs, huge rib flare here. See how the ribs are coming out?
Yeah.
With this type of drill, these will actually pull down into this position. So breathe in. See, it's all up there. It's okay. Breathe in, push my hands out. Nice and easy. Yeah, so we got some more work to do on this. It's okay. All right. How we feel with that? So did that? I know it felt harder for some, easier for others, but that's a really important piece of lower back pain, as well as all this neck shoulder tightness here. Some of you had what's called a rib flare, which means the bottom of my ribs, kind of right below the bra line, if you put your hand on that, my ribs should feel straight down. If I put my hands here and it feels like this little ramp and that my ribs are just sticking out like this, that's an immediate sign that like deep core is not doing its job, because that deep core attaches to these ribs. So when we work with patients and work on this, that rib flare will actually start to pull back into position. It's really common. It's funny, actually, when I met a girlfriend, the very first time we met, I like hugged her and I was like, oh, your rib cage is fucked up. I didn't say that, but I got jabbed by her ribs and I was like, okay, if this works out. Yeah, Haley's gonna immediately text her that and be like, oh yeah. Yeah. Okay, so the prescription here, 5 to 10 breaths anytime you think about it. The more you practice, the better you get. Laying on your back is easiest, then sitting, standing, walking, running, pure bar. Eventually, a nice test is I call it the poke test. At any point during the day, if I poke here, all around, it should hit a little pressurized core. If I'm like standing on one foot and juggling, it's going to be really hard for me to use the muscles this way. Eventually, with practice, it will be a new normal. And it's such a powerful understanding how to actually use your deep core. So important, especially with history of abdominal surgeries. Cool. Next, we're going to talk about bracing. So this is when I was talking about my least favorite cue, belly button to spine, like sucking in, because it makes us incredibly unstable. And again, I'm not trying to attack like instructors or things like that. It's just so common in Pilates, Pure Barre, exercise classes, yoga, like everyone just cues that, and it's one little tweak is going to make a big difference. So my superstar here, she just sit right here. So you guys have already technically been doing the brace by using that, right? So actually let's recheck. I want you to try and do that breathing drill without letting these come up. Yeah, no pressure, we're all watching. You're making me look bad. There you go, that's better. So we should feel expansion as she breathes in. These should come out. Not too bad. Breathe in, try and push my hands out. Yeah, there you go. Did you feel that? Great. So proper bracing. We're going to do it wrong, and then we're going to do it right, and you're going to use a super friend. So I'm going to push on you this way, and I want you to brace your core, like belly button to spine. Cool. Push that way. Pretty good. Okay. Now, you're going to do that cough. You're going to push out. Good. Maintain that. Hold. How'd that feel? Better. Yeah. I pushed a lot harder. First time I was pushing hard because you're strong, but I was only using one finger. But that second time, like I was actually leaning into it. So I want you to get your super friend. You're going to do just that. She's going to do a wrong brace. So she's going to suck in, belly button to spine. I'm going to push firm, right? Like I'm not like, whap. But I'm going to here, and I'm going to push pretty firm. Okay. And then she's going to brace. If she's hands here, cough and push out. Yeah, good. That's where we want. Hold that. Pushing firm again. She should feel a big difference, and you'll see this like locked in versus this little shake. Cool. Grab a super friend. So, again, first one is a firm push, belly button to spine. We're cueing this, squeezing in, and then firm push to the side. Yeah, push pretty hard, make them really work, make them work. And then you can put your hands here, have them cough. You can see my hands go out. That's core. And then maintain that and push again. Yeah, so you're going to go, bring hands here. I want you to cough and push my hands out. Good. Push out and keep them out. Good. Keep that, and then try and push again into her, however you pushed before. There you go. Do you feel that difference? Mm-hmm. Yeah. So that pressure you just created here and pushing out and maintaining that, this is what the pressure you need as you go to like pick something up off the ground. If something's really heavy or I'm doing a squat or something, I need to stabilize my core before that happens. Cool? That's great. Okay. It's okay. So we'll do one. Yeah. So you're going to suck in. Think belly button to spine. Belly button. So I'm going to push here. Hold. Don't let me go.
Yeah.
Okay. Now push out. Good. Cough. There you go. Keep that pressure. Keep.
Yeah, big difference.
Way better. Okay. So this pressure that you're creating here, when she coughs and pushes out, this is the pressure you should create lifting up something off the ground, going from sitting to standing, getting out of your car, bending down to tie your shoe. We want the core to automatically brace whenever we're doing a complex motion. A deadlift, right? Picking up a dog, things like that. And it is the brace out. If we're doing a max effort deadlift, you're gonna have to brace a lot, right? If you were just bending down to tie your shoes, we don't have to as much, right? We wanna make sure that we match the intensity to the intensity of the movement that we're doing. Does that make sense? All day though, this mechanism should be working 10 to 20%. That means our core is always active. So again, 5 to 10 breaths. Anytime you think about it, the more you practice, the better you get. Laying on your back is easiest. Standing on one foot juggling is hardest, right? Try to make a conscious effort of a little brace before movement. Doesn't mean just lower body. If I am braced before I pick up cup in the cupboard, now I have this stiff cylinder that my arm attaches to. When my arm attaches to this nice stiff cylinder, it can work its best. All right, so even with my shoulder and neck pain patients, most of the time we have to start here. All right, so you can do, if you've had shoulder pain and been through PT or chiro and you've done 1,000 of these banded rotator cuff exercises, well, if your core isn't strong, your arm is attaching to a weak foundation, right? If the foundation is weak, there's no point in fixing the other things, like fix the foundation first. Okay, questions on that? The breathing drill, do not practice it driving yet. You will get lightheaded because you get way more oxygen per breath. Research has shown you can get 4 to 6 times more oxygen per breath here than up here. So 4 breaths here are equivalent to 1 here. I have patients with like cystic fibrosis, meaning they can't breathe really well. We do this drill and it is like life-changing for them because they actually get air all the way into their lungs. So when you're driving, like what I was doing, going down 400, you can get very lightheaded. Do not recommend. So once you understand how it feels, then you're fine. You just get lightheaded because you get a lot of oxygen into your brain, which is generally pretty good. So just, again, not behind the wheel. Questions on that? Okay. Hips. Hips are going to be the next thing. So with lower back pain cases, the breathing, understanding how to properly brace your core is always number one. Again, I think I said we find this in like 98% of our patients with lower back pain. They don't know how to engage their core. If we don't engage core, then we can't engage our hips the right way. The hips attach onto the pelvis, which is controlled by your core, right? This is foundations. So we're going to do a test and a retest for hips. And we're going to do an exercise in between. It is a challenging one, but you guys are Pure Barre folks, so you'll probably be a little bit better. When I do this at CrossFit gyms, they got all these, big dudes with a ton of muscles, and I have them do this, and they're like, what is this? But y'all tend to do pretty good with it. Okay, so test, retest is going to be a seated 90-90. I'm just sitting here. Legs are about 90-90, knee and foot together. Just kind of make note of like how this feels. For me, right hip feels kind of tight. And we're going to switch to the other side and just compare. Is there pinching? Is one hip tighter than the other? Right? Make that kind of recommendation in your in your head. If this feels normal, both sides, you're like, yeah, cool, I'm solid, then this could be a beneficial exercise, but it's probably not your thing, right? So we're gonna do, I call this a hip blaster. It's one of my favorites early on with patients because it forces core activation. So we're gonna come back to that. And then we're gonna work on loading the deep rotators of the hip into this internal, external type of position. Yeah, I'll leave it at that. So, just watch the first one. I'm gonna be on my side, knees are bent, about 45 degrees. I'm gonna hover my top knee, start with our brace, and hover, hips up. Hand can go on my hip, and I'm reaching my butt back a little, and then I'm rotating my whole body over that front hip. And I'm gonna rotate back up, and then push forward by engaging my glute. So I go back, down, rotate up, and come back forward. And what we're doing, if we were to take a snapshot of what this looks like, note this foot is on the ground. I am loading my bottom hip into internal rotation. So what you're gonna do is we're gonna do 5 to 7 reps on one side, 5 to 7 on the other, and then we're gonna come back and retest. For me, that made this hip feel better. I knew my hips were tight. I had a hockey game last night, so, but that helped a lot of rotation here. Questions? So we're here, we lift, core is braced. I go butt back. I rotate over the leg just as far as I can, rotate back up, and then go forward. Knees stay hovered. Knee and foot are hovered over the top. If it's too much, you can post a foot on the ground or on your ankle. That's fine. I rotate down, rotate back up, and then squeeze my butt, come forward. Again, 5 to 7. Keeping core braced the whole time. This is really going to help find it. So, I'll rotate this way, just as far as you can, and then engage here to rotate back up, and then come forward, like you're squeezing your butt, tucking your tailbone. Yeah, good. Good. Back, rotate, 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 rotate. Good. Rotate back up, and then forward. More, 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 more. There. Good. Good. Again, 5 to 7 on one side, 5 to 7 on the other. There you go. And then back up, and then forward. More, 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 more.
Which way?
There you go. Yeah, there you go. As you go forward, think straight line from your knee to the top of your head. So when you push forward, really engage the glute to push forward. Good. Hover that top knee and foot. So we rotate. Good. Rotate back up. And then drive from here to come forward with your glutes. Yep, more, 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 more. Got it. Yeah, there you go. Yeah, tight hip flexors. So 5 to 7. That's pretty good. And forward, touch more, more, more. Yeah, there you go. And then once you're done with your 5 to 7, go ahead and retest your 90-90 drill. If this helped you, there you go. And then drive from there, come back forward and up. Great. Good. Yeah? Big difference? Okay. So if this made things better, great. If this didn't make things better, great. That's okay. Because it just tells us that your root cause is something else. If you're like one side, all of a sudden you drop in, and you're like, that's way better. This is a great exercise for you, and it tells us that we have a hip imbalance that we need to get squared away. There are more motions in the hip, but this is the most common one we see with lower back pain. One of the most common is a lack of hip internal rotation. Really important to be able to internally rotate and control here.
Can you do that standing up?
That exercise, there are other versions to do standing up. This is the one on the ground is kind of preliminary because the standing up one is much more difficult. I don't think I'm good enough to cue a whole room through that one yet. So, so who felt a big difference with that? A couple. Good.
My sciatic nerve has been hurting, so I've researched that usually because of your hip.
Mm-hmm. Are you feeling something down the back of the leg now?
No.
Okay. Were you before?
Yes, before the class.
Okay, that's huge. Yeah. Yeah. It's fine. I just did an Instagram post about a medical doctor told me that exercises don't help that. So it's kind of cool to.
I was really stiff when I walked in, so.
Yeah. Okay, so that's a great point. Whenever muscles get, one of the biggest things we hear is like, man, we'll just say hamstrings. My hamstrings are tight. And you're like, cool, let me see how you stretch your hamstrings. And they're like this. And it's like, well, how long have your hamstrings been tight? Like 20 years. How often do you stretch them? Every day. And how much further have you gotten? They're like, still here. Tightness does not mean stretch it. Tightness does not mean stretch it. It's such an important point. Tightness happens for a couple reasons, and one of them is not tightness how we actually think about it. Right? If my shirt is a muscle and I overstretch it, it feels tight. I do not fix this by stretching it more, right? I actually fix it by strengthening it. Now it no longer feels tight. That's so common with hamstrings. Most people have overstretched weak hamstrings and they feel tight because they're being stretched all the time. And then we hear tightness. Let's massage it, let's make it weaker, let's stretch it, and then this happens for 20 years and no problem. So that's one reason muscles can get tight because they're always being stretched. Another reason is it's a neurological thing. It means our brain is protecting our body. If I am unstable through my core, my brain is going to tighten my hamstrings to prevent me from hurting myself. So once we get people to actually activate their core, and we can do it pretty quickly, just literally cue them into that brace like we've already been done, person from 20 years will go from here to this because their brain finally feels safe that it can actually move and not get hurt. Okay, just side note on the tightness thing, because typically people who are the tightest don't need to be stretching. They actually need to be strengthening the right way. There's a lot of times where, and this is what I think about it, we'll do an exercise that's typically like a strengthening type exercise, and they feel looser after. It's because we've calmed the brain down. It doesn't have to throw a ton of tightness to try and prevent me from hurting myself. Now we're stable and strong, and now I can move better. I know it's can be a lot to wrap around if you have always been stretching tightness. So, yeah. What questions do you guys have?
So did you say originally to practice 10 or 15 times at a time, the breathing part?
Yeah, I think 5 to 10 breaths is pretty good. I mean, more is better, absolutely. My patients who get this better quicker, they do more.
So like 2 or 3 times a day when you're thinking about it?
Yeah, just...
Because it's not going to come naturally.
Yeah. So just anytime you think about it, just do 5 to 10 breaths. Like if you catch yourself at the computer and you're like, oh no, hold on, let me 5 to 10 down here. Okay, we're good. But we want it to be the pattern all the time. Until like any point during the day, we're pressurized. If I'm breathing up here, this is not, yeah.
So this should alleviate lower back pain.
Yeah. This has been shown in research. We can literally decompress the spine by getting these muscles active. So I'm not a big fan of a lot of decompression therapy. Like sometimes it can help, but if we just change the breathing pattern, we can literally take pressure off of the spine from just getting pressure through there. So, what other questions you guys have? Like I said, y'all are a silent group. I did one of these at Pure Barre, Alabama. I could barely get a word in.
Other specific, I know you were saying, so lower back pain is stretching helpful, and I know you're saying strengthening is helpful too, but if you're specifically feeling more lower back pain than usual.
Sure.
Because my back pain is like this,
Mm-hmm.
it comes and goes.
Yeah. So stretching isn't bad. Like I'm like the anti-stretching person, but like stretching's great. I think stretching under load is really good. But lower back, it just gives a temporary relief, right? This is most common. Lower back hurts. Everyone loves a good pigeon stretch. And like this feels good, but it actually makes it worse long term because we're getting into a really deep glute stretch and we actually need to strengthen the glute.
I do this thing a lot, but it's kind of weird, but it's like on the back, like pulling this way.
Mm-hmm.
I feel it in there.
Yeah, so the breathing drill will help to decompress that.
Are you saying, like, because also whenever my back pain feels worse, I tend to not, like, lift?
Mm-hmm.
Because I feel like it'll make it worse.
Yeah, yeah.
I'll take, like, a couple of days off if I feel it more, and I'll just walk.
Mm-hmm.
Walking seems to help.
Yeah, walking